Yes, tack så mycket Lars för din lilla introduktionen. Som Lars sa har vi ju pluggat IT-managementprogrammet vid Umeå universitetet de sista 2 åren. Och nu i somras har vi skrivit vår masteruppsats. Och där forskade vi om data-driven innovation inom den svenska hälso- och sjukvården. Och det var lite extra spännande för varken Ramy eller jag kommer från Sverige, så vi har väldigt lite egen erfarenhet med det. Så det fanns mycket spännande att upptäcka. När vi kör själva presentationen alldeles snart, då kommer vi switcha till engelska såklart så att vi båda kan prata. Men om ni har några frågor, då kan ni självklart skriva dem på svenska i chatten och då kan vi ta dem sen. Yes, and with that said, we will start to look where we came from. What we see in many areas of life is that lightweight technologies such as smartphones, smartwatches with many sensors are rising, and they are facilitating our everyday lives. If we look on Swedish healthcare, although the Swedish healthcare system is perceived to be one of the best in the world, we see that there are some shortcomings which need to be improved. And these are on the one hand, long waiting queues, which the patients face when they need some treatment. And also the people working in healthcare, they complain about bad working conditions. So that needs to be improved. If we look on digital innovation nowadays, we see that it usually is based on big amount of data about the individual in order to customize some services. But again, in healthcare, the handling of data is very restricted due to a good reason, which is privacy. But we see that digital innovation is happening anyway in healthcare, framförallt in Sweden. And with that, we came to our research questions: what are the conditions and the practices of data-driven innovation in Swedish healthcare? And with that, I will hand over to Ramy, who will talk a bit about our research journey.
Thank you, Stefan. So as Stefan mentioned, that we started having a research journey that focus in exploring 2 main areas. The first area is the legal situation. So we started reading the relevant laws and policy. And of course, we have in Europe the General Data Protection Regulation. And specifically, we have in Sweden, Patientdatalagen, and we explored how it regulates how each healthcare provider should build their own journal, own patient journal, and how it should share data across different organizations and so on. And it somehow we saw a bit of strictness and protecting the patient data, of course. And the other area is doing a market research, sorry, to see the types of healthcare platforms in Sweden. So we have main 3 types: public healthcare platforms that mostly belongs to the regions. So region like Stockholm have Alltid Opet and so on. Region Västra Götaland has another app, and Umeå and so on. And they provide primary care through their hospitals and through these new platforms. And they aim and focus on defined geographical area, their region, of course, to serve the citizens of this region. Another type is general private healthcare platforms, where they provide primary care and they have clinics in some parts of Sweden, in some areas, not whole Sweden, but through the app, they serve the whole Sweden. And the final, like Kry and Dr. SE and the Min Doctor and so on. And the final type is specialized private healthcare, where they share the same models, they serve whole Sweden, but they are specialized in chronic diseases like blood pressure, like migraine and so on. And they focus on treating the patient with only this chronic diseases. We wished to have a third part exploring in our research journey, which is approaching or having the chance to explore eHealth Manhattan and have a contact with them, but we couldn't, and it could like have a different, like give different perspective to the whole research, but the focus was the regulations and the current market in Sweden healthcare market. Next slide. So as an academic researchers, we saw some trends in academics that, like Stefan mentioned, that innovation today happens based on data. All types of organizations are seeking to know more about their customers and optimize their service and change their service and change their business model based on data. And from that, we saw the like the rising and how platforms are disrupting now industries, also based on data. We have in the market platform, of course, like Uber and Airbnb. Uber disrupting the transportation industry, Airbnb disrupting hotel industry, and the list goes on. And also we see the trend that the AI is used in healthcare. An obvious example that was mentioned in a lot of papers, using machine learning and image recognition technology to detect some diseases, some diseases in the CT scans and X-rays, and it could help in the diagnosis process through this image recognition technology. Next slide.
Yep, and with that, we had a deep look in the healthcare sector itself. As Ramy mentioned, we had a look on Patientendatenlagen, and there were two very important points for us, or for data handling. The first is that the main and primary use of data is treatment. So you as a physician or as a healthcare provider can access the patient's journal for treatment. But the secondary usage for research, for example, is restricted. And the second point, which derives from Patientendatenlagen, is that the data about an individual patient is not in one big database, but all the 21 regions and all the other healthcare providers, they have their own journals, and with that, the data are scattered. We saw in healthcare that even over the past decade, technology had a big impact, and we also had a look on how AI is in Swedish healthcare. We'll come to that in more detail later on. But another very interesting case about AI in healthcare was China. That's a very different country, of course, but what they have is, for example, so-called 1-minute clinics. So if you are ill, you can open an app, fill in your symptoms, and then within a couple of seconds, you get your diagnosis to that. Why can they do that? They can do that because they have a big abundance of data. And why do they have it? Of course, in China, the privacy laws are much, much weaker than in Sweden or other Western countries. So, for example, the healthcare providers there are also able to get third-party data, for example, from telecommunication providers, which would be not imaginable here in Sweden or any other Western world country. We also have a different focus of healthcare in China. As we know in many Western world countries, the focus is on the health of the individual. But China has a different approach. They have many rural areas, and therefore they have the focus on the overall population's health, Folkhälsa in Swedish. Just a side note, that has a lot of political implications and reasons. We do not judge them. We just saw that it is like that. And the last very important point to consider in healthcare is ethical concerns. For example, AI liability. Coming back to the example that Ramy mentioned, radiology, what happens if the diagnosis is wrong? Who can be held liable? Is it the doctor? Is it the programmer of the AI? We don't know. It's not clarified yet. And another thing is trust or acceptance. Trust in technology is not always there, and also healthcare professionals who have worked for a long time and also had years of training for doing their work, they have it naturally hard to accept that an algorithm can do some work tasks, not all, but some work tasks in a couple of seconds. And the last point, which is a very important ethical concern in healthcare, is their interhuman relation. And with that, we saw that there are some kind of technological developments, and they have the potential to solve the problems that we saw in Swedish healthcare. And with that, we had a look on what is hindering the healthcare. And yeah, since this also is a law event here, you have a lot of knowledge about that. And the first obvious one is the impact of the legislation. Most of our Patientenlagen and GDPR. And we saw, as mentioned before, that data is scattered. And from a system, from a database point of view, that is really bad. We also see that data sharing is hindered. You are not easily able to access other regions or other healthcare providers' journals. And so you have only a small amount of data. And although there are some legal restrictions, we saw that the possibilities that are given by the law are not fully exploited yet. And that, by the way, is also in line with what Hertz has pointed out earlier this year, I guess. Yeah, and although all of the organizations we talked to clearly stated, yes, legislation is one big hindrance for utilizing data, they also clearly stated it's not the only one. There are also very important factors which are more organizational and structural. For example, legacy systems. Most of all the big regions who are working for a long time have legacy systems they just cannot switch off because they need them. We also saw that the data that are existing in the journals are immature. There are many different journal systems, and although there is some kind of standardized terms in medical area, the people who enter the journal data, they do differently. So you cannot just take them and put them into an algorithm, for example. Another very important point was that the responsibility for developing and sourcing those systems is decentralized in Sweden due to the regional structure, which led to buildup of silos. If a region or a healthcare provider sources a system, they look that their needs are satisfied, but they usually did not have a look on interoperability. And besides those organizational and structural factors, there were also some soft factors such as trust in AI or AA liability, as mentioned before, and also organizational inertia in regards to organizational change. Then we come to the next point where we had a look on the AI applications that we see nowadays in Swedish healthcare. And there we saw 4 different types. The first one that already is in place is administration. It's non-clinical, it's just to automate some administrative processes. Next point, we also saw user experience improvement. If you do not have your talk to the primary care via a phone, but you have an app, you can see where the people dropped out and so on, and there you can improve the user experience. The first medical use case which we saw was triage. So again, if we call you primary care in the classical way, you get some questions, the nurses ask you, and then they say, okay, you need to see a nurse, you need to see a doctor, you need to do whatsoever. And that can also be done with an automated query, and you can get an algorithm which takes that decision for you. And the last use case, which we saw, which already is in place nowadays, is decision support. How does that work? If we think on the last type of healthcare provider that Ramy mentioned, the private specialized one for some chronic disease, they have a lot of knowledge about one particular field, and they can send huge questionnaires, 70, 80 questions, which normally the doctor would need to ask. And then the algorithm or the system can manipulate it so that the doctor gets a nice dashboard and saves a lot of time in asking the patient. Having found them, we went one step further and mapped them. We saw on the downside there, with the rising level of medical involvement, also level of technical AI sophistication is rising. And in addition to the 4 that I just talked about, we also have automated diagnosis, maybe in China what we have nowadays, and in the future even automated treatment. That was an interesting finding to see it like that. And we went even one step further and mapped the 3 types of healthcare providers that we saw nowadays on that map where they are. And that looks like this. When we think about the public healthcare providers, regioner och kommuner, they are restricted to administration. they think about triage, but they have a lot of mainly legal thoughts if they can do it. And when we had a look on the private general healthcare providers, Kri, Dr. Shigefira, and so on, they do administration as well. They do user experience improvement, but they also use it for triage. And if we look even one step further to the specialized private healthcare providers, they use it for decision support. Again, why can they do that? If we have a look on primary care, they have a broad range of all medical diseases. And if we look on the specialized ones, they take one slice, one particular chronic disease, and they have a large amount of data on that particular one. And with that, they are able to create such applications. Yeah, and with that, I will lead over to Ramy again with some further explanations.
Thank you, Stefan, again. So we had we started to providing some theoretical and practical contributions. So we found out to compare the healthcare to commercial business and see how they utilize AI and so on. Needed to have a different perspective because they are different. So the first point, why they are different, healthcare from commercial business, that the aim and purpose of the healthcare ecosystem in Sweden is to provide equal care, while any commercial business looks for profit maximization. And even the private healthcare providers, specialized and general, they have limited monetizing mechanisms because they are first regulated and part of this healthcare ecosystem, which is tax funded, which are funded by taxpayers and have limitations for setting the pricing and so on. So they have a different situation here in Sweden when it comes to increasing pricing or trying to increase their profits. And also from a platform perspective, there is a limited applicability of network effects, as we mentioned, for example, Uber, where the platform model helps that this network effects nature, which is more drivers will lead to more service seekers, more people seeking a transportation, and more people seeking the service will lead to more drivers and so on, because more drivers will lead to covering a better or more areas, and having more users on the platform will lead to drivers opting into the platform, which will not typically happens in the healthcare context because we have already limited healthcare human resources, and we don't think that more patients will lead to more healthcare provider, at least on the short term. So this network effects will not apply easily. And the last point that also Stefan mentioned briefly, that interhuman relation, where it's in example like Uber or Airbnb, the customer or the user doesn't care so much about the service provider, while in the healthcare, the service provider is a crucial factor for the service. So the doctor, the nurse have the role of analyzing and understanding the patient case and having a conversation with him, and even how he smiles and how he talk to the patient is very crucial and important, and how he analyze his context and his history and so on. So that makes also different the different nature of healthcare when it's compared to commercial business. Next line.
Perfect. We should try to wrap it up now,
okay,
because
yes,
time is going fast.
This is the last slide. So the practical contributions that we call out for better cooperation between private and public sector is needed, because as Stefan mentioned, we have structural barriers resulted from the scattered data across different databases. How this data is shared is very regulated, and how this data is structured make it hard to be shared and so on. And improving that and changing that will have a great impact on data-driven innovation. In the same time, we have a public sector that has operated for tens and hundreds of years, and they gathered a huge amount of data from the patient. But as Stefan mentioned, they using data-driven innovation in the administration context only, while the private sector has the capabilities, have the technology, have the innovation. So cooperating, like the cooperation between the public and private sector will lead to a better healthcare service for the Swedish citizens. Thank you.
Thank you very much. Very interesting. I put your thesis on the chat on the stream so people can access it. And I think you have your, what do you call it, contact information there so they can come back to you. Thank you very much. I will give you a little bit of a digital applause if you could see.